Hi everyone, welcome to competitive pharmacy. First question, relative sweetness of sucrose to saccharin. Option A, 1 is to 100. Option B, 1 is to 500. Option C, 1 is to 400. Option D, 1 is to 200. So relative sweetness of sucrose is about 500 times more sweeter. So the answer is option B, 500 times more sweeter than sucrose. Next question. Drug which is an inhibitor of cytochrome P450 enzyme. Drug which is an inhibitor of cytochrome P450 enzyme. So for this you have a code. Inhibitors stop cute kids from eating grapefruit. Here I indicate isoniazid, S indicates sulfonamides, C cimetidine, K ketoconazole, E erythromycin, G grapefruit juice. One thing I want to convey is grapefruit. This is actually the inhibitor of cytochrome 450, not our regular grapes. Not our regular grapes. Grapes is not an inhibitor of cytochrome P450. Just for information, I am telling this grapefruit is actually the inhibitor of cytochrome P450, not these grapes. Okay. Next question. Carbyl amine reaction is given by A primary amines, B secondary amines, C tertiary amines, D all of these. So the correct answer is primary amines. Carbyl amine reaction, also known as Hoffman isocyanate synthesis, is the synthesis of isocyanate by the reaction of primary amines. So the correct answer is option A, primary amines. Next question. Choline antibiotics such as amphotericins are most likely to option A inhibit DNA synthesis, binds to prokaryotic ribosomes. Option C act as anti-metabolites. Option D react with the sterols in the membrane. What will choline antibiotics such as amphotericin B and nystatin do? They react with the sterols in the membrane. So the correct answer is option B, react with the sterols in the membrane. Next question. Stas auto method is used in the isolation of A alkaloids, B glycosides, C both A and B, D none of these. Alkaloids may be extracted by three methods. Extraction of alkaloids involves three methods. So oxalate extraction process that you all know. So oxalate apparatus, we are continuously extracting using different solvents, organic solvents. Next is Stas auto process, Kippenberger process. So Stas auto process is treated with powder is treated with ethanol that is previously acidified with the tartaric acid. Kippenberger process, what we do, powdered drug is treated with the tannin in glycerol. Kippenberg, tannin in glycerol. Stas auto process, ethanol previously acidified with the tartaric acid. So the correct answer is option A, alkaloids. Next question. Antihistamine with the diphenyl methyl group. Option A, methyldilasine. Option B, cyclisine hydrochloride. Option C, phenyramine. Option D, phenindamine. So diphenyl methyl group is contained in this cyclisine hydrochloride. Cyclisine hydrochloride. Cyclisine is an N-alkyl piperazine in which one nitrogen of a piperazine ring is substituted by a methyl group, while other is substituted by a diphenyl methyl group. Diphenyl methyl group. So this is what piperazine moiety. This piperazine moiety diphenyl methyl group substituted by a diphenyl methyl group. Once again, I will try to draw. This is benzene rings. Okay. So this is actually the heterocyclic nucleus is piperazine, but the substitution is with this diphenyl diphenyl methyl group. Okay. So the answer is not this option A. This is option B. Option B is the correct answer. Cyclisine hydrochloride. Next, chemical classification of antihistamines. So you have seen this is what piperazine. Piperazine is cyclisine. Piperazine is bucyclisine, cyclisine, mecyclisine, hydroxyzine, oxatomide. These are first generations. First generation. Second generation you have already know. Citrusin, levocitrusin. These are piperazine. Citrusin and levocitrusin are piperazine. Piperazine moieties, levocitrusin. So these are second generation. Others are alkylamines. Alkylamines have a phenyramine group. Phenyramine word at the last, phenyramines. So the exception is triprolidine. Then what? Dimethindine. Second generation is acrevacine. Only one second generation is there, alkylamine, acrevacine. So ethanolamine. So it having a X and amine. Doxylamine, pendoloxamine, carbinoxamine, clemastine, diphenhydramine, dimenhydrinate, you already know. Diphenhydramine and dimenhydrinate, this belongs to ethanolamine. Then ethylene diamine have an amine. Amine, not hexamine. Hexamine is ethanolamine. Ethylene diamine do not have hexamine, simply amine. Amine and solid. It's an exception. In piperazine, bucycline, we have already seen. Piperidine have adding groups, astine, addine and astine. So aspartadine, cyproheptadine belongs to first generation. Other astine and addine belongs to second generations. Okay, hope you clear this topic. Chemical classification of antihistamines. Next, which of the following is a protease inhibitor? Which of the following is a protease? To identify the protease inhibitor, just to know, at last it have navir. Navir at the last, navir. So, exception. This is not a navir, this is vir. So, the option B is the correct answer. The clearance and volume of distribution of a drug is 1.5 liter per hour and 60 liter respectively. That is, clearance is equal to 1.5 liter per hour and volume of distribution is 60 liter. So that is given in the question. What is asking? What is the predicted half-life of that drug? Half-life. So we have the formula Cl is equal to Ke into Bd. Okay. Ke we all know. K is equal to 0.693 divided by T half. No doubt in it. So rearranging, we have get T half is equal to 0.693 into Vd divided by Cl. So 0.693 into Vd is given as what? Vd here, Vd 1.5. Isn't it? 1.5. So clearance is 1.5. Vd is 60 liter. 60 divided by, so 0.693 into 60 divided by clearance 1.5 clearance. So the answer is 27.72. Option B is the right answer. Question number 9. Which of the following NSAID is a pyrrole derivative? Option A, aspirin. Option B, ketorolac. Option C, sulindac. Option D, phenylbutazone. Classification of NSAIDs: salicylic acid, aspirin, all you know. Propionic acid derivatives. These are also asked in competitive exam, which are all the propionic acid derivatives. Pro, N is there, naproxen, ibuprofen, anhranic acid. Phenamic acid should be at the last. Fluphenamic acid and mefenamic acid. Then oxycam derivatives. Oxycam will be there at the end. Then pyrrole derivative. Ketorolac, etodolac. So pyrrole derivative is the question. So ketorolac, lac will be at the end. So option B is the right answer. Then next is indole derivative, indomethacin, pyrosolone derivative, phenylbutazone, oxyphenbutazone, azaprothazone. So the correct answer is option B. Next question. Manner of labeling of drugs are specified in the Drug and Cosmetic Rules 1945 as per Rules 96, Rule 90, Rule 105, Rule 106. The correct answer is option A, Rule 96. Okay. Thanks for watching. If you like this video, please like and subscribe.